Hello, I'm Kayla Roman, and I will be highlighting top professionals providing senior financial services. Today, we are meeting with Samsan. Hi, Samsan.
Hi, Kayla. How are you doing?
I'm good. How are you?
I'm doing good.
Good. Do you want to start off just by telling me a little bit about yourself, maybe your family or hobbies you have?
My name is Samsan Needler, currently living in Lawrence County, Pennsylvania. I went to Mohawk High School, graduated from Robert Morris University in 2020. Now I'm currently working at Eric Needler Insurance Agency with my dad. Been doing good.
Thanks for sharing that. How did you get into insurance, health insurance in general?
So I guess I can't really answer that question without, first stating my father, Eric Needler, he's been in the health insurance industry since 1996, specializing in Medicare, and he's kind of been with the industry, through like the entire time. So he's seen all the changes, like with Medicare Advantage and how the industry has undergone some different changes. A couple of years ago, after I graduated from college, I was living in Pittsburgh. I had a different job in the insurance industry as well. During COVID, I decided to move back closer to home, and ultimately from there, decided to pick up on the family business with my dad. So for the past 2 years, he's been a great mentor to me. He's been teaching me about all the different plans, how the industry works. So I've been becoming very well versed in Medicare, health insurance, and all the different products we offer. So it's been a good experience, and I've been enjoying it so far.
What are some of the biggest challenges that you see your clients facing?
I would say the biggest challenges really in the Medicare industry is just the overwhelming amount of information. So as an example, whenever someone first turns 65 and they're eligible for Medicare, it's like they're opened up to a whole different world. There's so many different options, the different terminology. So, really the biggest challenge is just becoming more familiar with Medicare and, the different insurance benefits and products available to you. And that's where agents like me or my dad can come in and just, we're masters of this area. We're able to just maybe come in and after an hour or two, maybe alleviate some of those concerns and just help you become a little bit more familiar with your options with Medicare.
And what are some specific goals that you help your clients obtain?
I would say, everybody's different. Everybody has different, financial goals, different concerns regarding insurance. So, let's say, somebody reaches out to me and says, Samsan, I've been on this Medicare supplement plan for the past, 10 years. It's just way too expensive for me. And I'm not getting any of these extra benefits that some of my friends are getting, like dental, vision, and hearing. Well, in that case, a goal of my client would be, we want to find a product that's a little bit more affordable for them and maybe help find a plan that does have some of those extra benefits. So really, it just kind of comes down to our clients on an individual basis and what is important to them, and just us coming in and helping them find a product or insurance policy that works best for their life and their different challenges.
Without divulging any specific details, can you tell me about a time where you helped a client specifically solve something with like a goal to overcome and something that really stuck out to you that you were really glad that you were able to help them accomplish?
Absolutely. So back in this most recent annual election period, when Medicare beneficiaries are able to make plan changes to their Medicare, I had someone reach out to me. They got a hold of our business card or my number somehow, and basically, to not go into too much detail, this woman, she was on a Medicare Advantage plan, and her plan did offer a dental benefit of a couple $1,000s. Now, unfortunately, her dentist was not in that plan's network, so she couldn't use her benefit. So her only question to me was, well, Samsan, I have this dental benefit, dental insurance is important to me. Is there any other option, or is there any other plan similar to the one I have right now that I would be able to use my dental coverage? So after meeting with her for, maybe around an hour, we were able to find a plan, that was well tailored to her life, and, also included dental coverage with her dentist in the network. So it's just stuff like that. We have clients reaching out to us where maybe they just have certain benefits that they are more concerned with than others, and just navigating the world for them. And, we know these plans like the back of our hands, and just knowing the ins and outs of these things where we can just ultimately come to the conclusion of, well, this plan works best for you and it has all these different benefits. I think we should move forward.
And if you had a crystal ball and could see into the future, what do you think some of your clients are going to be seeing as some of their biggest challenges in the next 3 to 5 years?
Well, I would say, if I could look into the future, I would say things that, myself and my clients would be, concerned with is probably a couple different things, just, revolving around Medicare still. Just what are the medical costs looking like, are they going up in the cost? Are they going down? Hopefully everything's staying down. And then also, is Medicare still solvent? Just overall, since Medicare is funded through the Part A and Part B trust funds, funded through, FICA employer taxes. We just want to make sure Medicare is still solvent and it's still something that works, right? So the two things is hopefully, medical costs stay down and Medicare is still a solvent industry.
Well, thank you for taking a few minutes to meet with me today and share a little bit about yourself and about what you do. I really appreciate it.
Yeah, thanks, Kayla. Thanks for having me.
All right. Thank you. Take care.
All right.
Bye.